First, the patient has to be prepared. Clean the injection site and apply a topical anesthetic. Draw 10 milliliters of blood into the vacuum tube containing separation gel and anticoagulant. Shake the tube gently to mix the anticoagulant thoroughly with the blood. Centrifuge the tubes for 10 minutes at 3,500 RPM. The plasma volume yield obtained in each tube after centrifuge on top of the gel is 6 to 7 milliliters. Attach the long needle to the 10 milliliter syringe. Remove the cap from the tube. Insert the long needle into the tube. Take care not to insert the needle too deep so as not to touch the gel. Carefully draw about 3.5 milliliters plasma from the surface down. We have now removed the PPP phase. We will not use this plasma because it contains very low amounts of growth factors and proteins, and it can therefore be discarded. We are now ready to harvest the platelet-rich plasma, PRP. The platelets stick to the top part of the gel and form a kind of sediment there. To free them, they will have to be suspended in the plasma remaining in the tube. Do this by pumping using the syringe and the needle. In other words, gently drawing and injecting the plasma a number of times against the gel. To do this, take the syringe and the needle you used previously and insert the needle into the tube. Being careful not to touch the separation gel, draw the remaining plasma into the syringe. Now, carefully inject the plasma back out from the syringe against the gel. Carefully repeat this process 2 to 3 times with circular motions until all the sediment of the platelets is suspended in the gel. When this has been done, return all the plasma to the tube. Insert the needle into its sterile cover and put the syringe and the needle aside. Cap the tube. To ensure that all the platelets are in the plasma, mix the remaining PRP volume by vortexing at medium speed for 30 seconds. Peel the sterile cover from the filter sleeve to halfway from the edge of the filter to expose the filter and part of the sleeve. It is important not to touch the sleeve or the filter. Hold the cap through the sterile cover and insert the filter into the tube until it gently touches the gel surface. Take off the cover. The PRP now enters the sleeve cavity through the holes in the filter. Attach the 10 centimeter long needle to a 1 to 5 milliliter syringe. Leave it in the filter and use it to draw all the PRP into the syringe. Inject with 29G needle attached to the syringe. Inject into the dermis using both superficial and deep dermal stimulation techniques. For superficial stimulation, use multipuncture mesotherapy technique. You can inject using either nappage or point-per-point techniques. For deep dermal stimulation, use linear threading or fanning. You may inject any area of skin you wish to treat: face, upper and lower neck, chest, back of the hands, and forearm. You can inject all areas of the face, including upper and lower eyelids. It is recommended to apply cold compresses to the face after injection.